Welcome to Elephant in the Room, a podcast featuring real conversations with real therapists on the elephant in every room, trauma. With this show, we are aiming to share insights from professional practitioners on trauma, its impacts, as well as various modalities and resources on healing for survivors. This podcast is produced by the Breaking Free Foundation, a Canadian registered charity that supports trauma survivors in reclaiming their lives and finding healing. All of the therapists interviewed on this podcast are members of the Breaking Free Foundation Trauma Practitioner Network. My name is Amber Craig. I am a trauma survivor, one of the co-founders of the Breaking Free Foundation, and the proud host of this podcast. Today, I'm pleased to be joined by Marie-Claire O'Donoghue. Marie-Claire is a Canadian certified counselor and registered dance movement therapist at the Moving Self Therapy. She uses dance and movement therapy as well as authentic movement in her practice. Please welcome to the podcast, Marie-Claire. Thank you for being here.
Thank you. Thanks for having me.
So, easy question to start off with. If you could just expand a little more on what I just said about you, give us a little bit more of your background and your areas of expertise.
Sure, yeah. I feel like there's always the longer version of the story, or there's the condensed version. But essentially, I grew up dancing, fell out of love with it, kind of disconnected from the joy and embodiment of movement, and then found my way back to it from this therapeutic lens in 14, 15. And then I discovered the field of dance movement therapy in 2016, and I started my education in the field in 2017. And at the time, I was actually running my own business that was focused on using movement as a tool for social and emotional learning. So I was working with children at the time. And then I did my master's of counseling in 2020, got that completed, and then have been in private practice for about 2.5 years as a dance therapist. In terms of areas of expertise, I focus a lot with individuals who identify as neurodiverse, whether that's diagnosed or not. And I have a wide range of experience with people with various cognitive capacities and developmental stages in life. Being trauma-informed is steeped in the work that I do. And I also, just like a little caveat, that I feel a lot of the self-identified traits of neurodiversity can also present as symptoms of CPTSD. And so sometimes there's kind of a cross overlap around what people are experiencing in their healing. So, yeah.
That's a great thing to add, actually. To kind of get into our conversation a little deeper, I'd love for you to explain to the listeners what dance movement therapy, or DMT, is exactly.
Yeah, it's a great question because not everyone has heard of it, right? Lots of people have heard of art therapy, music therapy, drama therapy. But oftentimes when I mention dance therapy, people are like, what? That's a thing? Yes. Which was my response too when I first heard of it. I was like, that's a thing. But so there's a couple classic definitions, and then I'll give you my sort of approach to it. So the American Dance Therapy Association defines dance movement therapy as a psychotherapeutic use of movement to promote emotional, social, cognitive, and physical integration of the individual. And then the Canadian Dance Movement Therapy Association, they talk about it as a basis of essentially that thoughts, feelings, and experiences of the self are expressed through the body and movement. And that this modality is inherently relational. It's a relational process that integrates our emotional, cognitive, physical, and social aspects of the self. So it's very holistic in its view. Personally, I see and experience dance therapy as a somatic and relational and sometimes expressive approach to therapy that can support people to experience themselves through awareness of their bodies, movement, and metaphor. I use a lot of metaphor in my work. I think that it's one of the most powerful tools in this work, is using movement as metaphor for what's going on internally. So, yeah.
Like you mentioned before, a lot of people don't know or haven't heard of this type of therapy before. So, can you walk us through what a dance movement therapy session could look like for someone who's just hearing about this for the first time?
Mm-hmm. Yeah, so I like to tell people that it literally looks different for every single person,
Yeah.
and it looks different every time as well. So it depends on many factors. One of the biggest pieces is just the comfortability of the individual in terms of actual movement. Because sometimes I'll work with like dancers, and they'll come in and be like, I want to move and I want to express my feelings, and they already have this connection with their um, movement repertoire or like movement language. Whereas some people come in and they're like, oh, I'm more interested in the fact that you work with neurodiversity. And sure, I'm curious about movement, but I'm kind of iffy about it.
Right.
So what does it look like? Again, it depends entirely on the person. Um, the way that I often describe it is what's typical is a person will come in, we'll start with some talk therapy, we'll start with some typical counseling, where we'll sit down, we'll talk about what's going on for them, we'll see, where they're at. Sometimes I'll start with a little bit of grounding if that's what someone needs, a little bit of breath or a little bit of just like arriving in the space, slowing down. Um, and then they'll talk about what's happening in their life. And then sometime throughout that conversation, I'll say, I'll identify a theme or I'll help them identify something that's like really clear for them that wants to be worked on. And then I'll say, I have an idea around a process. Do you want to try a process? So, and usually it comes with the frame of like, it's an experiment, or do you want to try something out with me? And I'll always like kind of lay out the idea first. So I'll say, maybe we could grab this prop. You and me could stand in the room together. You could, see what it feels like to move in this way. And then we'll come back and we'll talk about it. So typically it's sort of like a speak, move, speak session. But like I said, depends on the person. Sometimes people come in and they're like, I just need to move. Can you just put on some music? And like, we'll just start by like playing some music, and the person will just like have an experience of movement in their body while I mirror or join them or invite them into their breath or into their sensations. And then we'll go into talking. Yeah. And I do use a lot of props in my practice as well. So a lot of, again, with the importance of metaphor. Like if someone's speaking about a heavy weight in their life, like I have a bowling ball in my office that
Right.
sometimes I'll bring out and be like, okay, let's actually sense like what's it like to feel this weight and where is it in your body, and just physicalizing what's going on inside can really support people to find new insights and understand things differently. So
I think that paints a good picture for people. Who would you say could benefit from this type of therapy?
yeah, so one of the kind of catchphrases in dance therapy is they say from womb to tomb. So
Mm,
literally from birth to death,
yeah,
anyone who has a body, which is all of us.
right.
So yeah, I don't think there's anybody that wouldn't benefit. There's some contraindications, like for example, personality disorders don't always
Mm,
align super well. And again, I don't have a ton of experience working with folks with personality disorders, but from what I've seen and read in some research, it's not the most conducive treatment for that population. But other than that, it's like, from what I've understood and what I've seen in research, that it's can be truly beneficial for everyone and anyone, from anything from trauma to developmental disabilities to anxiety, depression, seeking more just emotional support around their lives. Yeah, it can really be, and it can be catered, right? Like we can do
right,
something different for someone who has these specific needs versus someone who has other needs, right?
right.
Yeah.
Um, so something that I noticed on your website was something called authentic movement. So
Mhm.
can you explain what that is?
Yeah. So authentic movement was birthed of dance movement therapy. But it is what's called like a layperson's practice. So it's therapeutic in nature, but it's not necessarily used as therapy, if that makes sense.
Right.
So what it is it's a contemplative movement practice, and it was founded by an early pioneer dance therapist named Mary Whitehouse. And she was also a Jungian analyst, so under Carl Jung's method of study. And in Carl Jung's lineage, there was this process called active imagination that some people might be familiar with, where people would take content from their subconscious, so dreams and other types of subconscious material, and make it creative. So they would write or draw or paint or make music about it. And Mary, the founder of this practice, was very interested in making the practice of active imagination more corporal or embodied. So, but she was also a dancer. So she wanted to use this process of how can we bring subconscious material to consciousness through the body,
Right.
through movement, essentially. So the practice is done. There's always, in the practice of authentic movement, there's always a mover and a witness. The witness has their eyes open and the mover has their eyes closed. There is no music, so it's all based on the mover's inner experience and how they choose to move based on that. And there are very specific guidelines and structures to this practice that, yeah, kind of keep it really contained. It's for the psychological safety of the people using it is why there's all these guidelines and structure. But yeah, and so it's in the same vein, but it's a little different.
Okay, so given that description, because you mentioned a couple of things that differentiate that from dance movement therapy, why would someone choose to do authentic movement over dance therapy or vice versa?
Yeah, so a big thing with the practice of authentic movement that they'll say, like a lot of my teachers have spoken of, is it requires like a really strong sense of your own internal presence and capacity to separate from challenging content. So oftentimes when we're working with clients in therapy, if we come up against something that's really challenging on the inside, clients might have a hard time separating themselves from it, and they become blended or merged with their content. And in a therapy, clinical therapy setting, our role as a therapist is to like support that, right? And to support the client to perhaps like differentiate or experience the experience, but without getting merged with it, if that makes sense. So in authentic movement, the person who is the mover sort of there's a requirement of a capacity to do that on your own. There's a bit of an expectation to be holding yourself a little bit in the practice. The witness is also holding the space and holding the container, and it's part of how we learn to embody that good enough benevolent gaze towards ourselves is through the eyes of the witness. But it's not always suitable for everybody, depending on what type of content they're coming in with and what type of capacity they have within themselves to tolerate challenging emotional experiences. So I feel like I could say a lot about it, but if that kind of makes sense. So I have used authentic movement with like 2 clients in the past 2.5 years, and just like briefly to say, hey, what if we tried this thing where like I'm just going to witness you experience this, and I kind of talk them through, and they've had some cool insights. But for the most part, it's something that is more like, let's say someone who joins like a meditation group and they're like, I want to go and I want to sit and I want to like be responsible for myself and learn how to watch the content of my own mind. Like it's more of that rather than the like, hey, I need your support to deal with and process this deep stuff, if that makes sense.
Yeah, that definitely makes sense.
Yeah.
Earlier in the conversation, you mentioned the word somatic a couple times, which I think is really important because that is coming up a lot in our community in the last couple of years, which is great. In your opinion, why is a somatic approach to trauma therapy important?
Great question. So one thing I always like to sort of like pull apart is that word somatic. Like you said, it's very commonly used these days, and a lot of times people will just say, "Oh, somatic means of the body," which is true to some extent. However, I like to, specify that the person who coined the term, Thomas Hanna, he spoke about it as it is the human as experienced through the body from within. And so another way to put that is that it's the first person, present tense experience of myself through my body. So it's not just like I'm getting a massage, it's somatic because it's my body,
Right.
It, it's what are you experiencing in this moment in your body, and how does it connect to who you are as a person, right? Um, so I think that why is it important? I think that giving people agency to connect with their own experience and their own inner authority around like what does my experience of myself in my body have to say about perhaps this past traumatic experience, or like how, rather than in so many medical professions it's very common to the professional to tell the client what's going on in their body. It's like, oh, I notice your muscle is strained, or your
Right.
this or that, or your organs or whatever, which is all
Right. Yeah.
helpful. But when it comes to healing trauma, I think that the first person present tense experience of the remembering of that experience, or maybe not even remembering, but of like how it has affected you today, um, is much more valuable and needs to be listened to. Like it needs to be honored, right? That your experience is actually the thing that matters, and how you, um, like how that person is able to articulate the sensations or the um bodily felt experience of like, oh, well, this traumatic experience caused me some anxiety. Okay, well, what is that anxiety? What does it feel like? What
Right.
transpires in your body? um it can really be the ticket to finding the root of the issue, and finding like a more holistic resolution. So it's really, we all know the body keeps the score, and I
Yes.
think that it's beautiful that it's becoming so apparent in people's work. Yeah, so it's very important.
Absolutely. What kinds of results or benefits can be common for people who incorporate movement into their healing practice?
Yeah, so this is one of the reasons I love my work so much, because oftentimes, especially in this past year or so of my practice, I've had some really neat experiences with clients who've come in and been like, I've been in therapy for years and I feel like I understand all my problems, but like they are not going away, or I can't seem to get a hang of my routines or whatever. They have like a cognitive understanding of things, and each therapist they've seen has been like, yeah, you get it. You've got it. Go on, you're good,
Yeah.
Um, and they come in and they're like, but I still like there's something that's not integrating. So what kind of results? Like I've seen people who have like fully new perspectives on things, new insights, ideas or concepts that they previously have understood cognitively, suddenly clicking in a new way, where they're like, oh, this is the thing, or like, this is the reason, or whatever it is. Um, it can allow emotions to move more than ever before. A lot of times people will come in and they'll say, oh, I don't know how to feel my feelings. I don't know how to connect with my emotions. Using the body is a really powerful way to just allow some of that energy to move. Um, I've heard some of my dance therapy teachers talk about emotion being energy in motion. And so if you're not moving, if you're not finding motion with that energy, it kind of stagnates and can cause blockages in the body. Um, so yeah, new understandings of old experiences. I just think the power of metaphor, visualization, and then the use of movement um, is just so central to how people experience benefit in the work. So
Just as you were kind of talking, I was sort of imagining myself in this scenario and like getting really anxious about it because I'm one of those people that has like performance anxiety. And I'm also just thinking about people who are introverted. Like, what would you say to someone who has that perspective about trying something new like this?
Yeah, well, a big like key to how I work is just meeting people where they're at. And
Mm,
so, if we were doing a meet and greet, for example, and you were like, I don't know about this, I feel kind of nervous, I would assure people that like I'm not going to force you to dance. I'm not going to,
right.
we're not, everything is a choice. Everything is consent based. Everything is, if I give you an idea that I'm like, ooh, I think it might be interesting to try this, you can be like, I don't want to do that. And I'll be like, okay, let's try something different.
Yeah.
There's a lot of ways to use the hands, like just starting with the hands and being like, okay, what might you represent this feeling with your hands? More introverted people might also feel more comfortable going inside, and so doing more of that sensation work.
Mm,
Maybe it's a little more mindfulness, eyes closed. Okay, we're visualizing how an emotion is showing up in, let's say, your chest, and we're gonna like get really clear on what that visual is. And yeah, so there's lots of different ways to do it. And sometimes when people are the most comfortable in that more mindful internal space is when I will, with rapport and time, is when I will start to kind of challenge them to be like, hey, can we stay relational, or can we um, do this together, or can you like look up at me while we do this, and just start to kind of challenge that a little bit to give, something new to
yeah.
people. Yeah.
No, I appreciate that explanation.
Mhm.
Are there any misconceptions about movement in therapy that you would like to address?
Yeah, well, especially because the field is called dance movement therapy. Um, People hear that word dance and they're just like, wow, that's not for me. Um, but one thing that one of my teachers and mentors, Amber Elizabeth Gray, she talks about how movement exists on a spectrum or on a continuum. And that continuum is sort of like one edge of expressivity to another. And the one side of the spectrum begins with breath. And so if we're working with our breath, if we're noticing our breath and how it moves in our torso, in our body, that is, we're using movement in therapy.
Right,
You're
right.
using breath, you're using movement. And then along that whole spectrum, the full other side of that spectrum is dance as we know it,
Mm,
right? It's like expression, it's like rhythm, it's all these pieces kind of put together. But through that whole spectrum, there's a ton of variety, right? That can happen
yeah,
within that. And so, yeah, I just like to remind people that sometimes there's misconceptions around like, oh, you're going to have me moving every single session. And I'm like, honestly, like maybe 7 or 8 times out of 10, like I'm not moving with clients. We're not always moving. It's
right.
much more just about connecting with the body. And then there are some people that it's like it's all about movement and that's all they want to do, which is also wonderful.
Yeah.
Definitely not a requirement. I wonder about potentially someday, like right now I'm sticking with the field of, registered dance movement therapist, but
Right.
someday I might change my wording a little bit to be more like embodied or somatic or something like that. Um,
Yeah.
More aligned with the work. But the
Right.
movement's also very important. So yeah, it's
Hmm.
hard to figure out exactly, but
No, I love that explanation. I think it says a lot about what it is and what it looks like. Um, because this is a topic that I myself hadn't heard too much about, and probably some of our listeners, are there any resources that you can recommend for anybody listening who wants to learn more about dance movement therapy or authentic movement?
yeah, totally. So the American Dance Therapy Association, or the ADTA, is like a huge hub for resources. They actually have a journal called the American Journal of Dance Therapy that can be accessed through their website. And that journal has, you know, decades worth of people's writing on the topic and research and all that kind of stuff. Another book that I love is called Body Mind Psychotherapy, and it's by Susan Aposhyan, who she's a dance movement therapist, but she also kind of delineated and created her own school of work that is called Body Mind Psychotherapy. But it's a really good book to connect with if you're curious. And then another good one is called Getting Our Bodies Back, and it's by Christine Caldwell. She's also a dance therapist, and it's primarily about addiction recovery. But I find it can be a really lovely read for anyone who's just kind of like trying to get a sense of what this body work, movement work is. Sorry, I wrote down a few. And then the last thing, like I said, the American Dance Therapy Association, so the ADTA, they have a YouTube channel, and they have like sort of their own version of like TED Talks, which is just like talks they've had at their conferences and stuff. And so a lot of those can be really neat if you even just YouTube like dance therapy and trauma or dance therapy and autism or whatever. Like their YouTube channel has a ton of really great talks. So
That's perfect. Our listeners love resources, so that's perfect.
yeah.
I always ask everyone the same question, but do you have any resources that you like to recommend on the topic of trauma in general?
Mm-hmm. So there's two books that came to mind for me. One I'm sure you guys have, or many people have heard of, but it's The Waking the Tiger by Peter Levine. That one is one that I find really accessible for wanting to learn a little bit about more embodied and somatic work with trauma. Peter Levine is a wonderful expert in the field. And then another one is called The Body Remembers, and it's by Babette Rothschild. I can't remember if she's a dance therapist actually, but it's a really great resource on trauma specifically and body-based healing. And then the other name I like to give is, I mentioned her before, but my teacher, Amber Elizabeth Gray. She is like, would never call herself an expert, but I am like, you are an expert on trauma. She's been working for like 30 or 40 years with survivors of like political torture, extreme trauma situations, as a dance therapist. And yeah, like she's wonderful, and she's spoken on a handful of podcasts. She's based in the US in Santa Fe, New Mexico. But she also has a newsletter and a website. So yeah, Amber Elizabeth Gray, any podcasts of hers are, yeah, she's a brilliant resource. And I think
That
she's
is so.
actually, I was just gonna say, I think she might be co-authoring something with oh gosh, I can see his face in my brain. What's his name? Anyways, maybe I shouldn't like making unreleased information. I should
Right.
Dance movement therapy and trauma is very Amber is the person for that. So
Amazing. I appreciate all of those resources because there's a lot that we haven't heard before. So, like I said, people like the resources. So all of these will be listed in the show notes for anybody who wants more information. Um, really, thank you for this conversation. It's a topic that we haven't covered. It's something that I didn't know a lot about, and I purposely wanted to wait for this conversation to hear you explain it because I always find that's how I like to digest my information. So I really appreciate you taking the time. Is there anything else that you would like to share with the listeners before we close?
I don't think so. Yeah, I'm grateful for the opportunity, and I love what you guys offer to the community, what Breaking Free Foundation offers. And yeah, and just also a reminder that if people are interested in dance therapy, to also look it up, or feel free to reach out. Like I get emails often from people being like, oh, I'm curious about you know educating myself in this or learning about this more. And I'm happy to share resources, because a lot of, because it's a lesser known field in Canada. I think advocacy is really important.
Mm.
And also, I'm aware that I'm a relatively new practitioner. So I'm still learning myself. I'm still taking extra courses, IAC supervision, but I do think that it's a really, really powerful modality. And so, yeah, happy to share everything I can. And with that, little caveat that I'm always learning as well. So yeah.
That is amazing. Thank you so much. Yeah, thank you, Marie Claire, for being on the show today. For more information about her and her practice, please see our show notes. The Breaking Free Foundation offers therapy grants for trauma survivors in Alberta, and we also host 2 free support meetings a month. One is in person in Calgary, and one is online. For more information on trauma therapy and our organization, please visit us online at breakingfreefoundation.ca. If you enjoyed this podcast, please subscribe and share. That's all for now. Stay well.